And also another important exercise regime is for the who are having the balance abnormalities. So these are is called as the Otago exercise program. So this Otago exercise program was developed to especially to reduce the falls in the older patients. So especially so these consist of this Otago exercise program, also called as OEP. So this OEP consists of the 17 type of the exercise. So in the 17 type of the exercise are going to be the 5 types are going to be the like a strengthening exercise. 12 type of the exercise are going to be the like a balancing exercise. So total 17 exercise is going to be helpful to improve the balance in the who are having the is a loss of balance. So this is going to be this balance, the 17 strength and balance exercise and also walking program performed the 3 times a week by the older adults in the home, outpatient and also community settings. So at least they have to maintain, they have to participate 3 times, thrice a week. So this thrice a week, it should be in the home and also outpatient and also community. So wherever they want, they can participate and also these exercise, simple exercises, but these simple exercises are going to be helpful to improve the muscle strength and also improve the balance. So these exercises can be done individually or in the group settings. So these studies demonstrate this is the Otago exercise program is going to be participants and participant experience to a 35 to 40% of the reduction in the falls. So according to the statistics, according to the evidence-based support, so evidence-based researches, so these is Otago exercise programs are going to be is reducing the 35 to 40% of the falls. So this program is the most effective for the frail for older adults. So who are like the fear to have fall, or maybe is the weak who are having the weak muscles. Or this is going to be more useful and also is effective in to prevent the falls, especially in the older patients. So these just now we discussed the 17 exercise. So these 17 exercises going to be the 5 exercises are going to be the strengthening exercise. 12 exercises are going to be the balance exercise. So if you see so this starts with the 10 repetitions. So each exercise, so we have to do the 10 repetitions. So it takes around more than 1 hour. So if they practice, so it's a weekly thrice. So we are going to be improve the strength we improve the strength as well as improve the balance in the trunk as well as the lower limbs. So first one is the strengthening exercise these strengthening exercises are the knee extensors. So which is also knee extensor, especially for the quadriceps muscles, and knee flexors, hamstring muscles, hip adductors, so adductor muscles. So and also we are going to the next one is the plantar flexor, the calf muscles, and dorsiflexors is going to be so these 5 muscles, so different exercise we have to give. So these exercise, so how to give the strengthening exercise for the knee extensor? So we can give the manual resistance, mechanical resistance with the therabands, and also we can use the weights, and we can use some gym equipments, and we can use the sandbags and springs. So anything also we are going to use to strengthen the knee extensors. And also without any equipments also we can give the manual resistance by the therapist, and also we can if we give the self resistance with the self squatting exercise. So if you do the squatting exercise also, so it's also going to be improve the strength in the extensor muscles. So same like we are going to do for the flexor compartment, that is a hamstring, and also adductors, and also next one is the plantar flexor, that's the calf muscle, gastrocnemius and soleus, and also dorsiflexors. So these muscles are we have to individually we have to give the strengthening with the therabands or maybe with sandbags and also weight cuffs. Anything also we can give to improve the strengthening. If we give the strengthening, so we are going to prevent the weakness in the muscles. So it will help to maintain the posture, static postures. So coming to the balance exercise, so these balance exercises are going to be knee bend and also backward walkings. So knee bend means, so in the single leg standing, so ask them to do the knee bend, or maybe the double leg standing also ask them to do the knee bend. So nothing but is the squatting positions. We can in the different positions on the hard surface and also soft surface and foam surface. So we can ask them to do the squatting positions. So who are just now we discuss about the balancing or the like a Bose equipment. So these bending, knee bending is going to be increasing the proprioceptions. So this proprioception is helpful to improving the balance. And also backward walkings. So, and also walking and also turning around. So backward walking, sideward walkings, and also zigzag walking. So ask them to zigzag at figure of eight, at Z shape. So sim and the zigzag at Z shape. So draw a Z like a letter. So ask them to turn on the we ask them to walk on the Z letter. So or maybe is the we can ask them to like a agility trainings. So agility training ask them to sudden changing the direction of the movement. So this type of activities are going to be increasing the balance activities. Sideways walking and also tandem stands. So ask them to stand on the one straight line. So who are going to be like a catwalk, same like a catwalk. So we can drive one line, ask them to stand on the single like a with heels and toes together. So one heel, right heel are close to the left toes. So these things, if you maintain, so they are going to increasing the improve the balance. And also tandem walk. So walk like how they are going to catwalk, the tandem walking. One leg stand, ask them to stand on the one leg. Heel walking, toe walking, heel to walking backwards, and sit to stand, and also stair walking. So these are the activities. So these simple activities are going to be increasing the balance. So who are having the loss of balance. So we can give the so many variations like a heel walking and toe walkings, heel walking forward, heel walking backwards, and also heel walking sideways. Same, if we understand one concept, we can modify so many different type of the exercise according to the progression of the patient. So here we can ask them to tandem walk. So walk on the tandem walk forward and backwards. And also we can ask them to do the toe walking forward and backwards and side to side. And also sit to stand activities, sit to standing activities on the chair. Ask them to sit from the sitting position to the standing position without support of the hands and with support of the hands, and also variation of the hand positions, and also away from the body and towards the front, and also hip and shoulder flexion, and also shoulder like a flexion positions is up like raising the arms, and also ask them to raise from the chair. So these type of the variations if we give, so we can improve the like balancing activities.